I therefore call upon the Minister for Health and Social Development, the Honourable Carvin Malone.
Thank you very much. I think it's a bit of brilliance that this should come immediately after the Higher Education Licensing Act 2016. I don't know if it was planned that way, but it is quite unfortunate that it was. Mr. Speaker, I beg to move the second and third reading of the bill entitled Nurses and Midwives Act 2020. And Mr. Speaker, I move that the bill, shortly entitled Nurses and Midwife Act 2020, be read a second time. And as I move, I would like to introduce the reasons for this at this time. Mr. Speaker, when one speaks of the history of healthcare in the British Virgin Islands, by extension, they are speaking of the history of nursing in the British Virgin Islands. Nursing has been well accepted as a most noble, most righteous, most principled profession. Florence Nightingale, the founder of nursing, in her environmental theory defined nursing as the act of utilizing the environment of the patient to assist him or her in their recovery. She identified 5 environmental factors: fresh air, pure water, efficient drainage, cleanliness or sanitation, and light or direct sunlight. I take a strong view that none of these healthcare legislations, of which I have been afforded the opportunity to introduce and pass in this Honourable House, are of my own making, for I have only been here 19 months, 1 month past a year and a half. So it is tribute to all of the officials, all of the persons, all of those who have sat in this house before and are now seeing this come to play. Another strong view is that our history must be properly recorded, documented, and taught at our learning institutions. It is for these views that I have invited, and they have accepted, to be present among us Ms. Norma Benjamin, of whom you'll hear more about, the author of this book called Nursing in the Virgin Islands, a historic perspective, 1920 to 2017. We'll hear more about it, and it is one in which we would be able to, I'm going to speak more about it. We have Ms. Jacinth Honourable, the Chief Nursing Officer, here with us. Can they be afforded the opportunity to sit closer on the benches? Yes, please. Can you? You can take a seat further up. In the gallery. We have Ms. Sylvester, the nursing director, Ms. Gail Scotland, president of the Nursing Association, Ms. Roberta Ephraim, nominated chairman. As we speak, I've also invited, I'm not sure if they were able to, they were attending classes, the representatives from the 37 member students who had the summer program, of which member pledged their support. We'll talk about that at another time. But, Mr. Speaker, when one is receiving health care, and we have other persons because the PS is here and from my office. So we'll have an opportunity to have each of the persons be fully identified. Mr. Speaker, when one is receiving health care services, they likely will receive care from a registered nurse, a licensed practical nurse, or from a certified nursing assistant. They all work as part of the healthcare delivery team to offer services to those in need. Of course, these various nursing professionals will generally offer the first line of direct patient care, and they represent a major part of overall healthcare delivery. Nursing is defined by Virginia Henderson, a nursing theorist, as primarily helping people in the performance of those activities contributing to health or recovery that would perform unaided if they had the necessary strength and the will or knowledge. Mr. Speaker, in the book of which I spoke earlier, when we look at all of what the history, we spoke of, unless you record your history, it will be told for you. And it was not meant, basically, you wouldn't have it recorded in a way that you may well remember it. So when Ms. Norma Benjamin brought this book to the ministry, it was to Honourable Carvin Malone, enjoy as you read the rich history. So I'm not sure if she would have even thought about it being recanted here at this particular time. But here we are. Mr. Speaker, on page 35 of this, and I'll go through it only because if we don't repeat some of these things, then there are a number of persons who will never know because they would not go back. I'm going to make an offer of which I know that members will support again. In the early 1900s, persons living in the rural areas of the mainland Tortola and outer islands of the Virgin Islands had limited access to health care. There was no organized healthcare system in the islands. Economic activities consisted of small-scale agriculture, fishing, charcoal burning, and the rearing of livestock. Compared to today's standards, it was a rather simple way of life. Most women give birth to their children aided by midwives or grannies, as we are called, at home under conditions that were often far from ideal. Space was limited, furnishings scarce, and water supplies inadequate. The name granny was given to those women for their children's sake as a measure of respect for those persons. Mr. Speaker, on page 43, it really sets out some of the stuff that we had because we had to record our history. So on page 43, it says that the Midwife Ordinance, Cap 176, the regulations dated 26 January 1955, had specific regulatory laws governing the practice of, and I think I'm pronouncing this right, midwifery. Thank you. See, I got my nod from the back. So when I looked at the registrar of what we have, I looked, and in the book, it basically set out that they have a Virgin Islands midwives published in the Leeward Islands Gazette of 1955. So there are names and the villages and their addresses, right? So we have Mary Louise Davies, Iris O'Neill, Iris Muriel Penn. Then we have Emily Bradford, Victoria Cricky, Elizabeth Donovan, Christentia Freeman, of which Ms. Benjamin speaks proudly of. We had Rosa Malone, Rosalind Penn, and Tryphena, I think, Sprout. Tryphena Sprout. And Mr. Speaker, we speak now of the Midwives Board that was established in 1963. So who were the first here amongst those? Dr. Q.W. Osborne, Honourable J.O. Georges, Mrs. Mary O'Neill, the matron of the hospital was a member, and Miss Yolande Scott. So these are persons, unless the history was written, recorded, and it would have to be taught, people will not know about. They see it today and think that everything was rosy and dandy way back. But at the end of the day, when we look at this, so if we talk about the history of nursing, 1920 to 2017, we are now at 2020, we have 100 years of history of nursing. The original People's Hospital was completed in 1922. We've already indicated that we would be celebrating the 100th anniversary of People's Hospital. We hear that it was a cottage hospital first. And we heard, based on history, how that came to be. They had some cottages down on the flat. They took them apart, took them to the site, erected them there. Cottage hospital. So at the end of the day, the history is important for what we have to look at and make sure that it is known, because we have come a long way. It was just on Tuesday that we recognized that we have the accreditation, DMV-GL. It is important to know from whence we came. The history of medical service is the history of nursing, and so too it will be. 2020 have been declared the International Year of the Nurse and Midwife. And I had done a recording earlier in the year, and it says that Honourable Malone was lending his voice to the World Health Organization declaration of the year 2020 as the International Year of Nurse and Midwife. Honourable Malone said, the history of health and social development will work closely with the British Virgin Islands. The Ministry of Health and Social Development will work closely with the British Virgin Islands Nurses Association and other partners to create a long-lasting boost its professional status and make it sustainable in the future. The Health Minister added, we believe that developing nursing and midwifery and allowing nurses and midwives to work to their full potential are one of the most important things we can do to improve health. They are too often undervalued and unable to work to the top of their license, an extraordinary waste of talent and resources. Honourable Malone further stated that the Territory is committed to introduce legislations that will recognize and empower nurses to function in enhanced capacities as nurse practitioners and other advanced practice designations. So we're here today. Mr. Speaker, nurses and midwives have and continue to be the cornerstone of healthcare the world over. These professions touch humanity in every aspect, from preconception through birth to death, and every stage that lies in between. It is for this reason, the intimacy of nursing's involvement in human life, that the appropriate regulations and monitoring of the profession is crucial. Nurses undergo vigorous training in the schools of nursing, often culminating with a bachelor's degree in nursing. Graduation is the first step in becoming a nurse. Thereafter, the individual must pass an examination by a board of nursing which measures the individual's ability to administer safe care. This examination enables the nurse to seek registration and license to practice as a professional nurse. Without being licensed to practice, the public cannot be assured of the safety of the care being dispensed. Regulating the training of nursing regulating the training of nursing, ensuring that a standard is maintained, issuing licenses, ensuring continuing professional education, and disciplining a professional when necessary are all domains of the regulatory body. The Nurses and Midwives Bill 2020 seeks to regularize several anomalies found in the current legislation and makes adjustments to bring it into line with regional and international guidelines for nursing and midwifery regulation. This includes the regularizing of the category of other nurses, making allowances for the registration of advanced practice nurses, separating the processes of registration and licensure, and providing for different dental counsel. As the territory moves, Mr. Speaker, to re-engineering primary care, this category of nursing is poised to offer services in this area with vaccinations, counseling, maternal and child health and chronic disease management. Many of our local nurses are educated at the advanced level and may like to return home to contribute. However, not being able to register, to license, and practice at the advanced levels make the prospect unattractive to most. This bill, if possible, makes it possible to register and license advanced practice nurses, enabling them to practice at the upper levels of their training and skills, and the territory can only benefit. Mr. Speaker, advanced practice nurses include registered nurse practitioner, designated NP, registered nurse and anesthesiologist, RNA, that's correct, clinical nurse specialist, CNS, registered public health nurse, PHN. And number two, Mr. Speaker, it provides for the certification/regulation of assistive nursing personnel. The Act also provides a regulation of assistive nursing personnel. These are persons who practice in the community, perform some nursing tasks without any regulation. The Nurses and Midwife Council will now be charged with the regulation of these categories of staff, ensuring that they are certified to perform safely. These groups include the licensed practice nurse, LPN, the nursing assistant, the NA, the nurse technician, NT, nurse's aide, CNA, patient care assistant, PCA, patient care technician, PCT. Number three, Mr. Speaker, it corrects the anomalies in the current Act. A, it separates the processes of registration and licensure. Currently, the Act only speaks to registration of a nurse or midwife. This is the initial process in which a nurse or midwife is found eligible to be entered into a registry. Therefore, the nurse is expected to be licensed periodically and to keep the license current. The current Act is silent on licensures, and this is one of the anomalies that are corrected in the proposed bill. It provides, B, for provisional and temporary licensing and for inactivating and reactivating a license. Number C, it provides for the conduct of disciplinary proceedings and for related matters. It provides also, Mr. Speaker, for expanded definitions on the various categories of registrants. Number four, in this, Mr. Speaker, it allows for the Nursing and Midwifery Council to consult on the establishment of educational programs in nursing. The Council will assist with all educational institutions, hospital, persons, or organizations on matters pertaining to nursing, midwifery, and assistive nursing education, training, and practice, and to assist nursing schools and other educational institutions when requested in the development of curricula for nursing education. This ensures that training is linked to registration and licensure, and that the standard of practice is consistent to the benchmarks set by the Council for safe practice. Mr. Speaker, this will correct the current gap where persons trained at our local college will be considered for registration, certification by the Council, opening up employment and possibilities to them at a wider scale. Number 5, Mr. Speaker, this bill provides processes and procedures for the disciplining of a registrant. Unfortunately, there may be times when a registrant needs to be disciplined. The proposed act set out clear guidelines to follow in the discipline of a nurse, midwife, or assistive nursing professional or personnel. These grounds include professional misconduct, poor professional performance, non-compliance with code of professional conduct, illness, or disability rendering such persons unfit to practice nursing, midwifery, or assistive nursing, a failure to comply with any conditions under his or her license, a contravention of a provision of this Act, or any rules or regulations made under this Act. Mr. Speaker, and it also provides for an irregularity in relation to the custody, to the prescription of supply of a controlled drug or another drug that is likely to be abused, and 8, a conviction in the territory of an indictable offense or a conviction outside the territory for an offense consisting of acts or omission that, if done or made in the territory, would constitute an indictable offense. Mr. Speaker, this legislation, when brought into force, will bring the regulation of nursing in the territory in line with international practice and will set the platform for the furtherance of nursing in the territory. This being the International Year of the Nurse and Midwife, with the focus being to enable the greater participation and contribution of nurses and midwives to the health care of countries, it is the perfect time to introduce this piece of legislation. It falls right in line with ensuring that nurses and midwives are able to practice at the top of their license and training, bringing much needed care to those in need. If we speak, Mr. Speaker, of the progression and contributions to the development, in 2013, the Nurses and Midwife Councils, under the chairmanship of Ms. Vesely McTavish and with Mrs. Burnett Scatliff as Chief Nursing and Registrar, submitted recommendations to the Ministry of Health to amend the 2009 legislation as it needed to be broadened in scope and presented some irregularities that were not in keeping with international nursing regulations. This made it difficult for nurses to be registered in the territory to practice for nurses, to be registered in the territory to practice at the levels that they were trained. For instance, a licensed practical nurse in the United States could only be registered here as a nursing assistant. Likewise, an advanced practice nurse could only be licensed as a registered nurse. Most were reluctant to accept this demotion in practice scope and responsibility, and this presented a challenge, especially when recruiting nurses to return home. In 2015, actual work began with research and drafting the legislation. This was under the chairmanship of Emerald Pemberton and Jacinth Honourable as Chief Nursing Officer and Registrar. Work continued through 2016 with regional consultation through the regional nursing body of CARICOM and local consultation, and eventually a draft bill was submitted. Persons who worked significantly with this bill include Ms. Sylvia Wisdom, of who we spoke of earlier, Ms. Sandy Underhill, Ms. Gloria Foy, who was a past council member, Ms. Gretchen Hart-Penn, past director of nursing, Ms. Commission, nursing consultant, Dr. Oscar Ocho, head of the UWI School of Nursing in Trinidad, and other colleagues in the regional nursing body and the BVI Nurses Association. We thank Ms. Bina Solomon of the Attorney General's Chambers for the assistance given through this process. She has been a guiding star throughout many legislations for which we ended up here through this particular process. The council currently has members. The members consist currently Ms. Roberta Ephraim as nominated chairman, Ms. Emerald Pemberton as chairman. She, I think, has retired in that position. Members, Mrs. Etelspan, Ms. Maureen Smith Cricky, Ms. Cherry Ann George Smith, Ms. Shanice Leonard, and Registrar, Ms. Jacinth Hannibal, and Secretary, Ms. Rainier Powell. Mr. Speaker, when we speak of development of health care, I've stated here before, I'll state again, we have expended over $200 million in the past 10 to 15 years in the development of infrastructure, in buildings, in furniture, in equipment. We contribute $42 million per annum to the operations of the healthcare system. For that amount of money, it is not unwise, it is not unreasonable to ask for the best in primary and secondary care. We are on our way there. There's a lot of work to be done. And as I look from time to time, because I walk around with all of the contributions and the goals of the ministry, because you may not know this, but from the Ministry of Health and Social Development, we have 5 24-hour operations, of which we are empowered to make sure that they run effectively. They touch every sphere of your life. HSA is only one. Adina Donovan Home and the Home of the Aged in actually Virgin Gorda, that's 2. Number 3, we have the HM Prison. 4, the Safe Haven Transitional Center, and we have Rainbow Children Home. So when we are asked, because these are tough times, but when we are asked to cut the budget by another $5 or $6 or $7 million, it goes to the heart of programs. We have to be mindful that these are institutions that their doors cannot close. So we're going to do what is necessary, Mr. Speaker, to make sure that we have all of the legislations brought up to date. Here we have a legislation passed in 55, 63. It was passed in 2009. It was passed, I think it was 79, 2009. And here we are. We're going to push a button, but it was not because I was in here for 19 months. It was because a lot of work has been done to get this to where it is. So we can't hold any notion that this happened only because we are here. But we must push it forward. So too, must we bring the Health Services Authority Act up to date, 2004, the Antibiotics and Therapeutical Substances Act up to date, the Cemeteries Act, the Children and Young Persons, the Coroners Act, the Private Hospitals, Infectious Disease Act, the Prohibition Against Importation, Prohibition, Epidemic Diseases Ordinance up to date. We must bring the Mental Health Act of 2014 up to date. We must bring all of these legislation, private hospitals and ordinance up to date. We must bring all of these up to date. 36 legislations, 50 regulations, 35 policies. The Attorney General Chambers, no doubt they had to rename it the AG Chambers for Health and Social Development. Because we have most of the legislations embodied right here in this. But more important, they touch everyday lives. And unless we get it right, Mr. Speaker, we would be waiting and longing for a long period. So we have a lot of work ahead of us. Accreditation is just the beginning. We have a lot of work ahead of us, and we must be able to do this. And the team that has allowed themselves to be here today, the permanent secretary, my private secretary, the entire HSA, the public health department, our entire team behind this, and all towards one goal, making sure that this territory get the best healthcare system known to the region and the world. So I so move, Mr. Speaker.